Okay, on health disparities. This is what we think is going on with regards to health disparities. More than 30% SES, a little less than 30% racism, and so on. 10% of health disparities is probably due to medical care and genetics. So why are all the funds going to medical care and genetics? Because small p politics affect decisions. Because if laboratorians decide to fund, they fund labs. If geneticists seek the fund, they fund genetics. And if clinicians determine the fund, they fund medical care. Now, just in case you don't get this, look at the heads of the agencies that we are talking about in the foundations. We mean no disrespect here, but people tend to fund the things that they're comfortable with. And in order to solve health disparities, you have to fund the things you're not comfortable with. Little big P politics. Abraham Lincoln said you can't fool all of the people all the time. But then came the Reagan corollary. You can't fool most of the people most of the time. And in politics, that might be all you need to do. Death panels, birthers, HIV conspiracies. You can fool most of the people most of the time if you're very good. We've seen it. The struggle for social justice has been long. It has been throughout the history of our nation. It's been a continuing struggle between those who came for peace and justice in this country and those who came to exploit the land and the people. That struggle continues today. And so today, instead of Confederates, they're social conservatives. And those who came for peace and justice are now called liberals. But the struggle continues. I want to talk a little bit about social justice. One of the things ML, Dr. King, used to talk about at Morehouse was that social justice, that we arc towards social justice. And that is because in the end, truth will out. People can say pro-life, but then support war and executions? Or people can say that they're patriots and they hate Americans, or hate our president. Conservatives did not win in the last election. We didn't vote in the last election. It was not their win, it was our loss. And as we deal with this new post-Reconstruction period in America, it will be up to us to make the difference. Now, the first time I came to APHA was in 1969. I came and sat down in the audience, and as soon as I sat down, all the black people got up and walked out. And I said, what kind of organization is this? But at the end of that day, I was able to meet Dr. Kennelly, who then introduced me, the first black president of APHA, who then introduced me to Dr. Poindexter, who was the sort of grandfather of blacks in public health, and then Al Haynes, the real author of the Heckler Report. And out of those conversations came a sort of a goal, a phrase that we talked about, that what we would try to do was change the face of public health. And that's what we've been doing. Not completely, but to some extent. Social justice supports the development of more minorities in public health. And what we've been doing, we have started the first M.P.H program at an HBCU in Atlanta. There are now 9 M.P.H programs at HBCUs in this country. We started the Public Health Sciences Institute, which trains African American students in biostatistics and epidemiology. We forgive them if they go into health education and health administration, but we still love them. We've also started a Society for Analysis of African American Public Health Issues that met before this meeting, and we work with the Black Caucus. But what is troublesome is that these efforts lack the support they deserve. Because as difficult as it may be to work with an HBCU rather than a Harvard, the fact of the matter is that's where the action is. These programs focus on mentoring rather than role modeling. Role model is a great ego trip from people who think they're important, but it doesn't do a lot. It focuses on experience, on work, rather than exposure. It focuses on long-term goals rather than short-term objectives. It focuses on things that make a difference. That it's not how you look, it's how you feel that's really important. So, lastly, what I want to talk about is what I hope young people will be thinking about. Many of our young people are being developed into corporate leaders. Corporate leaders are people who believe that people should serve the corporation and the corporation should serve them. Servant leaders, on the other hand, are leaders who serve the corporation and demand that the corporation serves the people. There are people who would like to think that the Tuskegee study can't happen again. Well, if they mean it's not going to be 1932 again, yeah, they're right. But if they mean they aren't researchers who care more about bugs than papers and than people, I don't think so. If they think that institutions don't care about their own ego and about funds, I don't think so. It's still an issue. So I want to tell you another little story about a student at Morehouse named Tweed. Tweed was a good dresser, and Tweed was going to be a Baptist preacher like his father. And Tweed got his doctorate and went to a small church, got a knock on the door one evening, and Reverend Nix asked him to have a meeting at his church. And he said, oh, well, if you want to use the building, fine. He goes to the meeting, they start laying out what the issue is, and says that because it's at his church, he should chair it. The organization turned out to be the Montgomery Improvement Association, and Tweed became Martin Luther King Jr. He moved from being a corporate leader to being a servant leader. That is the kind of story I hope people will think about. Servant leaders come in all different kinds. This is my favorite picture of servant leaders, and for reasons that some of you know. But what I want to ask you today is, if there are people in this room who are willing to put people before papers, I ask you to stand now. And if there are people in this room who will put people before programs, I ask you to stand now. Thank you.